So here we have got a case of a 25-year-old patient who had been involved in a road traffic accident. Let's read the MRI of the right knee joint. So we'll first start with the joint effusion. If the joint effusion is seen reaching up to the suprapatellar recess and definitely filling it, we'll call it a moderate knee joint effusion. Then beyond which we'll give a look upon the anterior and the posterior cruciate ligaments. So here we see that the anterior cruciate ligament at its distal tibial attachment and its mid fiber is seen. However, the proximal fibers, the femoral attachment is not seen. So we can say that the fibers here, there is a full thickness discontinuity. So it is a full thickness tear of the anterior cruciate ligament. Here we can correlate the same thing in the coronal images whereby we see the anterior cruciate ligament attaching onto the tibial aspect. The mid fibers are seen, however there is no attachment at the femoral aspect. Then looking at the posterior cruciate ligament, we are able to see the PCL in its entirety. However, there is buckling of the PCL, but there is no tear. Now coming on to the menisci, we'll first start with the medial meniscus. So this would be the medial aspect. There's the fibula, that's the lateral aspect. So looking onto the medial aspect, we are able to see the meniscus, the bow tie appearance of the meniscus is maintained. And going on to the anterior aspect, here we are able to correlate the images. So we are seeing that there is some widening of the medial joint space, and the medial meniscus, the anterior aspect of the medial meniscus appears to float freely. So this can occur only if there is any tear at the root attachment. So this is the tear of the root attachment avulsion, we can say. There is it's a high grade avulsion of the anterior root of the medial meniscus, which is seen causing the meniscal horn, anterior horn of the medial meniscus to float up entirely. That is the medial meniscus. And now coming on to the lateral aspect, actually when we try and go towards the periphery, there should be the normal bow tie appearance of the lateral meniscus, but we are not able to see this. This occurs only when there appears to be a bucket handle tear. So a bucket handle tear is a type of tear where the anterior and the posterior root attachments of the lateral meniscus are intact. However, the rest of the meniscus predominantly, which appears to have been torn from the peripheral third, so the peripheral third would be intact and rest of the meniscus would be flipped inside, and it would be seen in the intercondylar region. So here we are able to see that clearly on the sagittal images. This would be the anterior root, this is the anterior horn which appears to have crumbled, and this is the entire body of the lateral meniscus which we are seeing, the body, posterior horn, and again the posterior root is intact. So it kind of gives the appearance of a double ACL. There is something other than the ACL which is also seen projecting in the intercondylar notch. So on the lateral aspect, there is the bucket handle tear with the flipped meniscal fragment lying in the intercondylar region. Now coming on to the medial and the lateral collateral ligaments, on the medial aspect we clearly see there is widening of the joint space. This can occur only when there is loss of constraint on the medial aspect. So the medial collateral ligament, it should run from the femoral aspect onto the tibia, proximal tibia. Here we are able to see the intact hypointense femoral attachment of the medial collateral ligament. However, on tracing it towards the tibial aspect, we see that there is a large fluid collection or a hematoma at the expected site of tibial attachments from where the MCL appears to have avulsed, and it seems to have been retracted proximally and is seen lying in the medial aspect of the knee joint in between the medial femoral condyle and the tibial plateau. So this is complete avulsion of the medial collateral ligament from the tibial aspect, and the torn fragment is seen insinuating within the joint space. This does require a surgery, it won't heal on its own, so this needs to be mentioned separately in the report. Now coming on to the lateral aspect, we are able to see that the
lateral joint space appears to have reduced. This might be because of the secondary thing whereby there is opening up of the medial joint space. So the lateral collateral ligament, it appears to have crumbled a bit. However, we have got the axial sections and we are able to trace the lateral collateral ligament entirely attaching up to the lateral aspect of the femoral condyle. So we have got a large hematoma on the anteromedial aspect of the tibia, proximal tibia. So this is the region from where the avulsion has occurred. Now coming onto the patellar retinaculum, the medial aspect of the retinaculum and the lateral aspect both can be traced entirely, so they are intact. Now coming on to the bone, there are multiple bony contusions. One, we can see the impaction fracture at the sulcus terminalis on the lateral aspect of the femoral condyle, and corresponding to it there is kissing contusion, a type of bone marrow contusion pattern seen along the posterolateral aspect of the tibial plateau, whereby there is a minimally displaced or minimally compressed fracture along the posterolateral tibial plateau. Also seen are the contusions in the proximal fibular head. So beyond the bones, rest of the bones appear to be normal. The joint congruence and the alignment appears to be normal. So now we'd like to go and inspect the posteromedial and the posterolateral corners. So going towards the posteromedial corner, here we are seeing that there is no edema, and the posteromedial structures, mainly the oblique popliteal ligament and the posterior oblique ligament. The posterior oblique ligament, which forms the major portion of the posteromedial corner, is intact. There is no fluid to suggest that any sprain or partial tear is there. Then now going on to the lateral aspect, as there is a bucket handle tear, we would expect the popliteomeniscal fascicles, which should be here somewhere. They are not seen, so they are likely to be torn, and there appears to be injury of the popliteofibular ligament as well, and the arcuate ligament, the posterior most aspect, which along with the capsule would be forming here. This appears to be deficient, and the knee joint fluid is seen extravasating in the posterior aspect of the knee joint. Now seeing the various muscles surrounding the knee joint, now, as we scroll down, we are able to see that there is some edema fluid which is seen along the superficial peripheral aspect of the medial head of gastrocnemius muscle belly, and as we come superiorly, we are seeing the extravasated fluid on the posterolateral aspect. And looking back at the medial aspect, the tendons we are when we trace, this would be the semimembranosus, and on the medial aspect we would be able to trace the semitendinosus. So semitendinosus gracilis would be there, sartorius would be there. This would go on and insert onto the proximal tibial proximal aspect of the tibia. On the medial aspect, there appears to be some kind of a tear, partial tear like thing, which is going on in the semitendinosus insertional fibers, along with which the fluid is seen tracking all along the posteromedial as well as anteromedial aspect. And we can also see that the joint capsule here appears distended. The posterior aspect of the joint capsule can be traced. This occurs because of the joint diffusion. So all in all, what we make the note of is the full thickness tear of the anterior collateral anterior cruciate ligament. Then there is a bucket handle tear of the lateral meniscus. Then there also is a high grade partial avulsion of the anterior root of the medial meniscus, along with which we have got moderate knee joint effusion. Then there is avulsion of the medial collateral ligament from the tibial attachment, and it appears to have flipped and crumpled up and is seen insinuating within the joint space. There are multiple marrow contusions, the pattern of contusion corresponding with the ACL injury. Also seen are the contusion in the proximal fibula, and there is significant posterolateral corner injury So it's injury to the posterolateral corner structures, and there is extravasation of the joint fluid outside of the joint. So this is an extensive report which occurs in a patient with a road traffic accident. Thank you.